Oh dear.
Okay, everyone, the time has arrived. It's 12 noon, and welcome to every one of you to this event. Thank you so much for joining us and participating in what I can safely say is a very unique opportunity to have a conversation with leaders in the field and also with our brilliant colleagues in recruitment, Hunter Healthcare, to help us step through what members of this network would have experienced firsthand. And some of us are interested in understanding the journey of people from a BAME backgrounds realizing their ambitions. So this event is going to be an hour and a half long. I will be chairing the event, and I am really privileged to do so. I'm a member of the Shuri Network steering group, and I am Heather Caudle, Chief Nursing Officer at Surrey and Borders Partnership NHS Foundation Trust. I have with me some fantastic speakers who will, again, through their experiences, their questions, their reflections, help us reflect on our own journey and set the scene for questions that we might have, or indeed answer questions that we may have had prior to the event. I'd like to start off by giving everyone who will be participating in today's event conference to introduce themselves. We earlier said hello to each other, and I started off a bit of a trend with everyone by mentioning first computers. But the first computer I mentioned wasn't mine, because growing up in Trinidad, my first computer was actually in a classroom being taught how to use computers. It wasn't the general experience of everyone in Trinidad, but I had my first computer very late in life. But my husband and my soulmate, he is a computer programmer, and his first programming experience was at the age of 11 on a Sinclair ZX81, for those of you. So I'd like to ask members of the panel and the conference today to say a bit about themselves, who they are, and I am going to go in the order at which my little cells are. So the first person I'd like to invite to introduce themselves is Yasmin.
Hi everyone, I'm Yasmin and I work at Hunter Healthcare alongside Rhiannon Smith and Tom Hodges and Holly Gray. I'm the office manager there, and I am helping, well, not coordinate, but I'm helping to just have any technical issues today. Obviously we're Zoom, sometimes it can't be, it doesn't always go smoothly, but hopefully it will today, and I won't be needed very much. I'm very happy to listen. And yeah, my first computer was a tiny computer, and there was nothing tiny about it. It was absolutely massive. I don't know if anyone else remembers them. But yeah, that's me.
Brilliant. Thank you, Yasmin. Rhiannon.
Hello, my name's Rhiannon Smith. I head up the executive search and non-executive search practice at Hunter. So I'm here today with a couple of colleagues from the Hunter team just to make some contributions about the sorts of people we're looking for and the sorts of skills and experience we're looking for when we're working with clients to recruit. My first computer, I told the team earlier, was a BBC Electron, because that's how old I am. But I had the amber screen. This is very important, not the green screen, because it was much cooler.
Brilliant. Thank you, Rhiannon. Aisha.
Hi everyone, my name's Aisha Rahim. I'm a consultant psychiatrist and deputy medical director and CCIO at my organisation, and I'm also on the Shuri steering group nationally. So my first computer was an Amstrad, and I remember in my head coming downstairs on Christmas Day actually, and this massive thing being covered with this bed sheet, and then covered it, and of course it was this first computer that we all had that lived in the living room, and yeah, we thought we were the bee's knees having that.
Brilliant. Sedi.
Hello everybody, I'm Sedi Frederick. I'm chair at North Middlesex University Hospital NHS Trust in North London, and I'm so old I can't remember what computers actually were, so I'm sure it'll come back to me. I think the first one I ever got was one that we bought our children many years ago. Interestingly, both who developed into IT wizards, so there you are.
Amazing. Thank you. Thank you. Mary.
My name is Mary Olubi. I'm Information Governance Manager and Data Protection Officer for Barnet Enfield and Haringey Mental Health Trust. I'm actually here to tell my journey, the story of my journey. And my first computer, I can't remember, but I just very much remember those days of carrying floppy disk around and trying to make it work.
Excellent. Tom.
Hi, I'm Tom Hodges. I head up the digital and analytics business at Hunter Healthcare. So we place interim and permanent digital specialists nationally, predominantly with the NHS, but also with the wider healthcare sector. And we work with specialists within project and program management, business intelligence and analytics, and also senior leadership appointments. I actually can't remember what my first computer was, but I will find out for the next webinar and let you all know then.
Fantastic. Well, the tweets that come out of this event, I think you can pop it on Twitter and
Yes.
you'll have a Google of that. Holly.
Yeah, I work alongside Tom doing the same thing basically. So digital informatics, recruitment, interim and perm. And I'm the same. I can't remember what my first computer was. I just remembered it was very slow and sat in the family room, and you're only allowed to use it for 1 hour a day.
Thank you. Sam.
Hi everyone, I'm Sam Shah, Chief Medical Officer at digital men's health company Newman, and I think my first computer was an Atari.
Brilliant, thank you, Sam. Shira.
Hello everyone, I'm Shira. I'm the co-founder and chair of the Shuri Network and also a GP in Tower Hamlets. I'm old enough to remember getting through medical school without computers, and I remember when they first introduced them to St Mary's right at the end of my final year, I avoided the computer room. So it's quite ironic that I ended up being a chief clinical information officer for my sins later, years later.
Fantastic. Thanks to all of you. And this event, like I said earlier, is very unique, if not, I think will be a trailblazer to other events. It's the result of a partnering with Hunter Healthcare and the Shuri Network. And Hunter Healthcare is an award-winning talent management provider. And what this is the start of is a series of practical workshops, which will hopefully encourage more women of colour to step forward and succeed in their digital careers. And our members, of which I think there are many, and of the 127 of you delegates who've signed up, and I'm sure as the morning progresses, more of you will join. What you said you wanted was advice on career pathways, and this series will provide some absolute gems of advice. So things like insights into emerging roles in informatics and health tech. We'll have the opportunity to think about mentoring and what how that can be helpful, and of course Sedi and Mary would help us with that today. Hopefully this will help improve your chances of success, and positive role model stories, career paths. And before I hand over to Shira, who will be telling us a bit more about the Shuri Network, I just wanted to share a bit about my experience. As I said earlier, I grew up and was born in Trinidad and Tobago. And I came here as a bright and bushy-tailed 21-year-old. I embarked on a career in nursing, and well, 28, 29 odd years later, here I am as a chief nursing officer. For those of you in the delegate pool or on the panel, you know what my journey looks like as a woman of color, and it is a tricky one. But what keeps me going is the opportunity to make a difference, might sound trite, might sound a bit simple, but making a difference is what makes me see the struggles as worthwhile. As part of my career as a nurse and my leadership, I have focused a lot on fairness and equity within my profession and generally in health. And I do strive with others to try and tackle discriminatory practices in a way that is positive and improves people's lives as well. I'm really looking forward to having a conversation with Sedi and Mary, because what also helped me in my career are people who made a difference. And some people would mark milestones in their career with events. I mark milestones in my career with people, with women and men who've seen something in me and helped take me to the best version of myself at that point in time. So I'm really excited about this morning. And our first speaker is Dr. Shuri Network. It's a bit earlier than scheduled. It's 4 minutes earlier. But if you don't mind, Shuri, I just wanted to say, to big you up a little bit before you start, and share with everyone our first meeting in NHS England in Elephant and Castle. Is it a year and a bit ago now? Where this beautiful, calm woman was saying what her vision was of really addressing the invisibility or the lack of women and women of color at senior levels in health tech. And what I saw in front of me belied the powerhouse of determination in Shuri. And those women who were with her on this journey to start the Shuri Network. She got me by the word Shuri because I was a Black Panther fan, and any network that has a superhero as their symbol, it's onto a winning start. So in Shuri, what we are seeing is the power that our contribution can make. The fact that we are able to be the best of ourselves in whatever we are interested in and whatever we've trained to do, we can save the world, which is what Shuri has done. So using that as an inspiration, what Shuri has done to get with Shira's leadership and others is mapped out a really strong program to help the NHS, and I dare say to help England crack this problem of inequality based on gender and based on ethnicity, and really to have allies in Hunter Healthcare to get to the root of these inequalities, the point at which you have that conversation with a potential employer. Today's conference would help us all collectively think about ways in which we can conquer that. Not in a way that's intimating there's something wrong with people of color, but this conversation is about sharing some tricks of the trade, speaking with a seasoned, award-winning talent management organization about what is the framework of employment, what is the framework of ambition from the point of view of an employer, and how we can share and expose the richness in the workforce when that workforce is made up largely of women and women of color. So I'll hand you over to Shuri now, who is the co-founder and chair of the Shuri Network and national clinical advisor on system transformation in NHS England. Over to you, Shuri.
Thank you, Heather. It's very hard not to cringe online on a Zoom or Teams meeting, but thank you so much for that introduction. The power of the network is exactly that. We are a network, and personally, I have found being part of that support network over the last 7 months incredibly helpful, because it's just been a horrendous year. But meeting people like Aisha, Heather, Rhiannon, Sedi, Sam, Mary, over the last 7 months, that's really helped on a personal level keep me going through some very dark times. So first of all, welcome to all our members, and particularly welcome to those of you who've joined the Shuri Network over the last few weeks and months. The Shuri Network is probably the only organisation in the NHS named after a superhero. And we champion three things. Firstly, patient safety. Secondly, we want to help the NHS deliver the digital transformation that it needs, that we need, to deliver the best possible care for our patients. And thirdly, as Heather said, we support women of colour to gain the skills, the confidence and the connections to succeed in careers in digital health. Because frankly, if we can do it, so can you. So the idea for the Shuri Network came to me about 2 years ago. I was at the time Chief Clinical Information Officer at Derbyshire Community Health Services. And I went to a big conference in Birmingham. And there were about 500 national leaders in the audience. And I remember sitting there and looking around the hall, and I saw about 4 or 5 other BME women in the audience. And to be honest, there were more BME women serving us tea and coffee and lunch than there were on stage throughout the whole conference or in the audience. And that to me just felt fundamentally completely wrong. So that's where the idea for the Shuri Network was born. Now, in just over a year, we've grown to over 750 members from across the country, including around 150 allies who are not female or BME necessarily, but who support our objectives. We've also got support from HEE, NHSX, NHS England, and NHS Digital, as well as private tech sector companies, and indeed Hunter Healthcare. So we take a really positive approach to change. And we do 4 things. We highlight successful role models who are people of colour, including all the speakers here today, because sharing our stories very openly and honestly is incredibly powerful. Secondly, we challenge the system to do better on diversity and inclusion. And the events of the last 7 months have really, I think, helped to focus the attention and highlight the inequalities within healthcare and within the workforce and the racism and discrimination that happens. So it feels like this is an opportunity we cannot miss to change things. We want to make careers in informatics more accessible and more inclusive. And we're helping to change the perception of what a digital leader sounds like and looks like, because they look like us. And increasingly, we need to change that perception, because if you Google CCIO in the NHS today, you will find a very undiverse group of photographs, because I did that last week. And lastly, we offer a range of practical support. So webinars such as this, with Hunter Healthcare, with the Health Foundation, with AHSNs, and with NHS England, for example. But we also offer our fellowship, and information can be found on our website. That includes bursaries to support your professional development. We've just finished our first round of bursaries, but we're going to expand that next year. And secondly, we are developing our shadowing program to give women of colour the opportunity to get a window into your world of being a digital leader, to see what it is that people do, to build those connections and the exposure to senior digital leaders. And we know that makes a difference when you apply for jobs and when you go for interviews. So when I was preparing for this talk, I was thinking about my experience as a CCIO, because I never planned to be a CCIO or a digital leader, ever. My background is as a clinician and as a medical director, so nothing to do, very little to do with technology, or so I thought. But what I realized is that we use data and technology every single day to provide effective, compassionate and safe care for our patients. And that's just been highlighted over the last 7 months, and the pace of change is only going to increase. But as a CCIO, I learned that there were 3 things that were really great about the job. Firstly, you get to implement change much faster than the NHS normally moves at. Secondly, you get to work with your team of clinicians and informatics professionals to develop services and products that people can understand and have a positive impact on their working practices. So in Derbyshire, we rolled out e-prescribing across 12 community hospitals, for example. And the third great thing about being a digital leader is that you get to grow your team and see them flourish and gain in confidence step by step. So when I joined Derbyshire, the nurses, because it was a community trust, most of our clinicians were nurses and therapists. They weren't happy about the EPR rollout program because of safety concerns, but we worked very closely with them to listen to what they were worried about, to solve those problems and questions, to be with them step by step on the way when the implementation of the e-prescribing project was happening on the wards. And as a CCIO, my job was to bridge that gap between the clinical team and the informatics team, and get them to see that they were people and not just computers or people that said no all the time. So my advice to you today is be bold. Don't rule out jobs because of one or two words in a job title, like informatics, because I used to do that. Build a support network around you. Build your personal board of directors, people that you can trust, mentors, coaches, because times are tough and you will need that support around you as you progress up the career tree. And thirdly, and really important, is find your voice and use your platform as a BME person or as an ally. However senior you are, use your platform to change things and make a difference to the people around you. And with that, I'm going to hand over to the fabulous Dr. Aisha Rahim from Lancashire. Thank you.
Thanks very much, Shira. So I suppose in terms of my thoughts about being a CCIO, the clinical lead for technology in my organisation, I guess similar to you, Shira, I'm an accidental CCIO. That's how I describe myself, because this was never part of my career trajectory. When I sort of went into medical school, I became a consultant. This is an accidental career path. So the job was advertised some years ago, and it was also tied with the deputy medical director position, which I applied for and got, and the CCIO was part of that as well. And as some of you will have heard at the start of the webinar today, we talked about our first computer. So I've always had an interest in computers in my personal life, and when the organisation occasionally puts out calls for some clinicians to get involved in improving things like the electronic patient record, I would often stick my hand up, partly born out of the frustration that things didn't work as well as I wanted them to, and I couldn't just sit by and let that happen without contributing to its improvement. So that was my motivation for being attracted to the role. Little did I realise that 3 years down the line, so much of my life is now taken up with digital health, and I'm really, really enjoying it. But it's not always going to be necessarily a very clear defined pathway. And I know there are lots of conversations at the moment about how do we make that career pathway a little bit more streamlined and structured, I suppose. So often you'll find people that have fallen into this accidentally, and that's okay. It's okay to do that, because sometimes what you don't realise is what the job really involves. So that's why it's helpful to have webinars like this, because when I joined, or I became a CCIO, I was really quite apprehensive, and I had this vision in my head about needing to skill myself up very, very quickly on technical things and know what APIs are. And there are so many acronyms that I now have in my vocabulary that I'd never heard of 3 years ago. What I've come to realise is actually that's not the most important thing. It's by far not the most important thing about being a CCIO. Actually, what CCIOs do, what clinicians working in digital health do, is about building relationships, communicating, and actually change management and transformation. Those are the key core skills from my perspective. And I don't know if that's something that you found as well, Shira, but the technical side of things, whilst you do need to have a little bit of an understanding of the technical stuff that's part of your job, there are a whole team of professionals whose entire professions and careers are built around the tech side of things. That's not something that I need to be an expert in. There are people much better equipped to do that. But what I see my role as is around leadership and actually bringing along people of change, because actually we call it digital transformation for a reason. It's not about plonking in a piece of software or a piece of new technology. It's around changing the way that we do our jobs. And actually, as a clinician, I know how my service works. I know how we deliver care for patients and to our citizens. That's the bit that I'm the expert in, or have some expertise in. And so alongside other colleagues from clinical backgrounds, we sort of collect that, we bring that together from all the different disciplines that exist within healthcare, and we come together to think, actually, how can we reimagine how we work? How can technology help us do the transformation? So actually, it's about being able to be that leader, be the person that communicates the possibilities, because actually it's really easy for all of us to get stuck in our usual way of working that we've done for, year after year. But this is the really exciting thing about technology. This is why I love doing what I do, because it offers us a new way of thinking and a better way of delivering care, a safer way of delivering care for patients. And so if you're going to be a leader in that space, or if you aspire to be a leader in that space, your communication skills are actually what's going to get you the furthest, and your ability to build up those relationships with many different disparate stakeholders. So, for example, when you undertake a transformation project, you're going to be coming into contact with lots of different people that have an interest in the project. And that might be senior people within finance, your director of finance. You might have a specific kind of conversation with your director of finance. That might be a really different conversation with somebody that's, say, a support worker on the ward who's going to be using this technology, because there will be different things that will be important to that person. So what you do as a CCIO, or what I do as a CCIO, is to find some way to communicate the possibilities of this transformation to different people, and altering the way I communicate depending on who I'm speaking to. And that's something that I think is a key skill of somebody that's involved in transformation. So I often describe CCIOs as needing to be multilingual. You need to speak the language of people at board level. You speak the language of your peers to get your peers alongside. You need to speak the language of somebody from a completely different healthcare discipline, and really understand actually what's in it for them, because actually if we're doing the right thing, it should make our lives better, it should make our patients' lives better. And if you can find that hook, that's the thing that I think is a skill of the CCIO, as well as bridging that gap with your technical colleagues as well. So I don't know how much that chimes with your experience, Shura, as a CCIO.
Absolutely. You do have to be both a strategic thinker and an obsessive completer finisher simultaneously, and a great communicator. But I had a great time as a CCIO. Sometimes the jobs you dread the most turn out to be the most rewarding. So I think our advice to you out there is, go for it. And the Shuri Network is here to support you on your way.
Yeah, absolutely. Because you don't have to look at a job description or a person's spec and be able to say, yes, I can do absolutely every single one of these things. And I've spoken about this in my personal journey quite a lot in other forums as well. But me applying for the post of CCO and Deputy Medical Director was a leap of faith. And I didn't think I met all of the person spec or all of the job description 100%, but actually being able to say, well, I can make a good bash at this. That was the thing, that the light bulb that switched on in my head. And informatics and technology was not something I was super comfortable with or very knowledgeable about. What I was knowledgeable about was around quality improvement and service development. And actually, that's the thing that's more important. So I think there is something about looking at job descriptions in a different way, and looking at person specs in a slightly different way, and maybe stepping out of your comfort zone a little bit. And there's also something about making links with other people that have done similar jobs, to link in with the Shuri Network, attending these kinds of webinars to really get an insight into what those jobs entail, because they might be different to what you expect.
Thank you, Shira. Thank you, Aisha. That was amazing. A couple of things, a couple of gems you left us with there. Shira, your advice to be bold, build your team, and use your voice. Such sage advice. And Aisha, I love the fact when you said that being a leader is about communicating the possibilities. Absolutely the case. Being multilingual, and in a way, taking that leap of faith. I smiled when you talked about applying for the job and not fulfilling all the criteria, because you must have heard the sort of folklore of men applying for jobs and women applying for jobs. Men saying, oh, I can only do, it's a caricature, guys, okay, sorry, but I can only do 10% of the job. I'll go for that. and women saying, oh my God, I could only do 10% of the job. I cannot possibly go for that. So you're role modeling this idea of taking that leap, looking at transferable skills. And I'm sure Tom, Holly and Rhiannon will talk us through that a bit more later on. But thank you both for that. And there'll be a chance for question and answers later on. And I'm slightly impatient for the next session because it's my opportunity.
If I may, if I may just say, I thought Aisha there was really interesting where you say taking inspiration from job descriptions, and I think in healthcare and indeed the NHS, it's really easy to look at job descriptions on NHS jobs every morning, and indeed it's something that we do as a business to really understand the trends in the market. But as well as being inspired by those jobs, one of the things we really believe in is career planning. And so if you're looking at those job descriptions and identifying with 25% of the person spec, then see it as a huge opportunity to plan how you're going to get to 50% of that person spec or 75% of that person spec, and being inspired by that challenge to further your own experience through whatever means you can, really. So certainly being inspired by job descriptions is something that I really agree with.
Absolutely. Thank you for that, Tom. And we will want to hear a lot more of that later on when you and Rhiannon talk us through the improving chances of success, definitely. So I'd like to now invite Sedi and Mary to unmute themselves, because what we will now have is a Zoom conversation about your relationship, quite frankly, with not wanting to put too fine a spin on it. Lower those eyebrows, Sedi. In terms of being a mentor and a mentee, and I've got some questions to ask you about your connection as mentor and mentee. And if I may, I wanted to start with Mary and ask you, Mary, to tell us about your journey. And I'm particularly interested, right, in the point of realization for you that this career was possibly going to be rocky as a Black woman, that your ambitions and that journey, when was that point of realization?
I think I came to that point of realization after I'd qualified and worked as a pharmacy technician in a mental health trust, because well, I've introduced myself earlier on, but I've worked in the NHS for 25 years with a background of qualified in pharmacy. So I started my career in secondary care, working in various hospitals in London as a pharmacy technician, and later I progressed to primary care setting where I work in prescribing technician. So that was when the turning point happened for me, when I worked in primary care, because in my role as prescribing technician, I was responsible. Actually, that was also the initiation of me working in informatics. That was where it began. So I was responsible for analyzing and using prescribing data to influence GP prescribing habits and promoting rational and effective prescribing of drugs. So I stayed in that role for 7 years and did well and progressed to the level of chief prescribing technician, which was the highest you can go as a pharmacy technician. So during that time, obviously I'm an observer. I like to look. I love good things. I see people in high position and I want to know how they did it, what they've done that I can do. How can I learn from their journey? Because I just want to, I think there's just this natural passion about doing well for myself and just maximizing my potential. So during the course of me working in prescribing, I was exposed to the world of strategic planning and service delivery. And I realized that there's more to primary care actually, and there's more to work as opposed to just being stuck in one area, which was all I knew was pharmacy and doing the world of pharmacy, but I seen something different. So that was where it started for me, that I decided I need to move on and do something different.
Yes.
And as a result of that, I obviously identified training needs for myself, and I enrolled to do a leadership program, which was sponsored by the NHS for BAME staff. So they call it NHS Leadership Program. It's a one-year full program. So I did that. So that was actually what equipped me for that skills transfer. And I was confident to know that, okay, actually I can get out of pharmacy now and do something new with myself. So obviously it was a very hard journey for a Black person, as you know, because obviously I did work hard in all my roles and faced quite a lot of challenges with progression. I had to work twice as hard to get to anywhere. But I was determined to keep going. So after my training, I obviously, nothing was forthcoming, but I was just not going to stay where I was. So I keep looking at the jobs. And like Tom said, sometimes you look at the job descriptions and think, oh my God, I haven't got what it is in there. I haven't done this, I haven't done that. But what I picked from my course was that if you see a job title and it attracts you, go for it.
Yeah. Brilliant. Brilliant.
I saw this job advertised by SODOC PCT at the time, Service Delivery and Development Officer. Obviously, I had to take a drop in salary because it's a commitment I made to do something for myself, and I was determined to go with it. So I went for that role, for that interview, and was successful to get the secondment for 6 months, which I kind of arranged myself. It could have been longer, but I knew my organization would not release me for a very long time. So I decided to go for the shortest opportunity, and they said, okay, we can give you this for 6 months. And I worked in the trust, working with primary care collaboration to deliver the various services in smoking cessation, infection control, and obviously with my pharmacy background, they used me also to support pharmacy projects, which was very beneficial and obviously good also to still be in that loop of my pharmacy world.
Yeah. Sorry, Mary, I was just...
After my secondment, because I did a lot with myself to get out, because it's not easy, but you've got to do what it takes. So after I finished my secondment, I got myself a permanent job in information, which was working as a primary care information facilitator, again, working with GP practices. But this time I'm actually using data quality to help them improve their patient outcome and also to meet the primary care information strategy target for public health and for the other enhanced services. So I carried on in this role as primary care facilitator, and during that I changed role into a business information analyst. So I became a business intelligence analyst. And then from there, I was able to secure myself a job in information governance, where I continued now. So that was the journey. As a Black man and mother of two, it was not easy, but I persisted because I knew what I wanted. And with regards to my connection and why I chose to have a mentor, obviously my journey has not been...
Mary, before we go on to that, I just wanted to go to SEDI, because listening to you, you are a unique package, aren't you? And you seem to bear the traits that that Shira and Aisha spoke about in terms of being very, I suppose, having a diverse range of skills, being that strategic thinker as well as that completer finisher. Very, very, very different things going on there. And I want to ask Sedi, actually, what was it about Mary that made you accept her invitation to be part of her journey?
Let me start off by just giving you a bit of background. My background professionally is primarily in housing and social care. So as a chief executive running some fairly large and complex social care organizations. In terms of my personal style as a leader, I've always felt it's been more kind of coaching and supporting. I was able 5 years ago to step away from full-time work and decided that I would really do what interested me and build a portfolio career, including becoming a coach and developing as a mentor. So I got an email out of the blue from Mary asking me to have a chat with her, which I did. And I could just tell from our first conversation that Mary was extraordinarily frustrated. Now, I haven't shared this with Mary, so I'm just sharing a personal perspective here. So Mary, no doubt you'll have your own, which you will share. And I just wondered, and I was intrigued by her background. She'd clearly been, as you shared with us, a very expansive and positive professional background, but seemed to come up against blockages after blockages. So we agreed that we would meet, and Mary came to my office at the Trust, and from our very first conversation, intuitively I felt that I could help Mary develop to the next stage of her career. I had a real sense of Mary's frustration, but there was so much that she could offer in whatever direction she decided to go. So I said to Mary, okay, normally as a coach and mentor, I work in 6-session packages. So I'll offer you 6 sessions. There was no fee involved as long as Mary was able to come to my office, and we got started. So really it was Mary's potential that I saw very early on. And I just thought her career shouldn't end at this point. I think Mary had applied for a number of jobs unsuccessfully. And I thought perhaps I could help her just break through to her next opportunity.
Brilliant. Thank you. Thank you, Sedi. And Mary, what made you take the initiative to use mentoring to help you? Sedi's just given us a flavor of what the issues were, but what was it that made you take that initiative?
I think it's like Sedi rightly said, at the time, obviously I've not really walked my journey alone. I've had people around me, but I was at a very crucial and critical stage in my career at the time, because normally when I go into a job, I will normally give myself a 2 to 5 year plan that depends on what I want to learn in that job. And as I was coming to the end of my 5-year plan in the role I was in 2017, I realized that I needed to progress, I needed to develop and use my skills differently. But I was not getting successful. I tried different things. I've applied for, I must have done about 10 or 12 interviews or more, and I wasn't getting anywhere. I did some within my trust. And as it will work, as I happen to, and each time I do these interviews, the feedback is just not very conclusive and encouraging. Oh, you were so good, you were so close, but we had someone that was better. And I thought, what else? What more do I need to work on? But there was never anything. And again, I just kind of, and I think the last one I had was, oh, you were so good, Mary, you this and that, but we're happy to offer you secondment opportunity. I said, excuse me? I said that in my head, if I'm good to be offered secondment, why don't you give me the job and develop me in that role? So I turned that down. No. And I applied for jobs, obviously, like you said, and 2 of them was within my organization where I was privileged to work with my competitors, whom I was told were better than me because that was the feedback. I was so close and there were people better than I was. So working with my competitors on those 2 different grants really made me to feel demoralized. I lost my confidence. And I begin to talk to myself, changing my mindset that actually, maybe that's it for you now, because you've been everywhere and done everything. And maybe you've come to yourself. And I started telling myself, perhaps I've reached the limit in my development opportunity, and there's just nothing else available to me, especially being a Black African girl who's done so much with herself. That, yeah, maybe just be grateful that you had the opportunity to come out of pharmacy and at least you had other exposures into other areas. So I was kind of on a very demoralized, downward trodden. I would say, to cut it, I was on a journey of self-sabotage in my career development. And because I work within North Central London Clinical Commissioning Group, one day in one of my CCG visits, I saw this note that, oh, North Middlesex have a new chair. Okay, with this new chair and then I saw the picture. Oh, it's a Black man. How did it get there? And knowing me, I'm always very inquisitive. I love good things. I was very happy for him, to be honest, but as much as I was, I had this thing, if he can do it, because I always say, if somebody can do it, then why not? So I said, I'm going to check him out and see his journey. But, you know, thank goodness for LinkedIn. It exposed.
We're going to check him out. I love it. Go on. Yeah.
Tell me more. You know, and LinkedIn just give everybody out. You just want to know, go on LinkedIn. And I went on LinkedIn and, yeah, I saw his profile. And at the end of it, he said a coach and a mentor. Whoa. That was what I needed. Obviously, I had my other friends and mentors and stuff, but I think I've had enough of it. I needed something different. And I thought to myself, I'm going to ask him to help me, even just see what it is. It took me some time to make up my mind, I must say, because I checked SETI up in October. And I pulled on the courage in November to send him an email. So I'm blah, blah, blah. I looked at, congratulations on your new role. I've just checked you out on LinkedIn. I realized you offer mentoring and support, mentoring and coaching. And I am at a stage in my career where I needed help, but I don't know if you can help me. And I was actually very surprised. He responded to me. And I was pleased. And the first thing he said is, I need to see your CV. Good job, I was prepared. And I sent my CV to him immediately. And proactively, he sent me an email to contact his secretary and find a day I could come and see him. So I had my initial introductory meeting with him in December, November 22nd, is a Friday. I went to his office, met Teddy, we chatted, and then he told me about his price and what he does, and I know definitely I couldn't afford that. And I said, I can't afford it, but I said to myself that even if he's just talking to him and picking his brain, I'm sure something will come out of this. And he said, and I said, oh, I can't afford that price, but whatever you think you can signpost me to do to help me, I'll be grateful. And he said, you know what, I'm going to help you.
Wow. Brilliant.
That was how I was. I just, thank you. And he said, well, before I do that, I need to know more about you. And he suggests I do an assessment of something like a assessment of your person. So there was this tool that he recommended, which is called the Judgment Index tool, which I had to, obviously you pay to use it, but the cost is not it's not too much. And you know what? If that is what I need to help me, I can find that kind of money. It's not.
It's an investment as well, isn't it, Mary?
That's how I saw it. So,
and Mary, sorry to interrupt you again, but I'm just mindful of the time. And I wanted at this point to ask Sadi a question about at the other side of it. How has being a mentor to Mary helped you, Sadi?
That's a great question. Well, it didn't help me financially, I can tell you. But for me, it was.
I think she's too good for that, Mary. You're a negotiator. Brilliant.
I mean, I think it was just a sense of personal satisfaction, really. When I first started talking to Mary, we just were talking in the abstract, and she mentioned an online assessment tool that I use as a coach and mentor. And I encouraged Mary to take this because it would basically tell me a lot more about her very, very quickly. It's a very powerful tool. And she completed it and it immediately painted a picture that I could work with. And then interesting, I think maybe at the end of our second discussion, Mary said that there's a job that she was going to go for. So that then gave us a real focus, a real opportunity to move the conversation from the abstract to what was real. There's a job coming up. Okay, we can now focus our attention on really making it or giving a sense of opportunity. I looked at the job. There was no reason why Mary wouldn't or couldn't get the job and wouldn't be successful. But it was about belief. And I felt that what I could offer Mary was the opportunity to rebuild her self-confidence. Before we started, first thing I said to Mary was about smiling, because when Mary smiles, the whole world changes. But I noted in our first two meetings, she didn't smile once. And I cracked as many jokes as I could. I did, but it took a lot. And in the end, I said, look, this has to be tough love. And I explained about having been on many, many interview panels, what I look for. The point she made about feedback, I think it's an outrage how panels give feedback, but unhelpful. So from my perspective, I just felt my role was to act as a mirror to Mary, and it wasn't about money, or it was just the opportunity to make a contribution. That's my motivation. In my career, people have been interested in how I got from where I started to where I am now. I had a couple of mentors before I knew what mentors were. And they really, really helped me. At the time, I didn't know what they were doing. I'm not sure whether they did, but I really, on reflection, could see that without those two people, my career would have stalled. So now to get to a point where I can perhaps, because of my experience, help other people in their careers, I consider it to be an honor. And that's not me being trite or whatever, but I think we have a responsibility, actually. People of color, I think I'm one of 10 BAME, and forgive the expression, chairs in the NHS, 240 trusts, 10 BAME chairs. That's not good enough. So it's not about pulling the drawbridge up, it's about a hand down, hand up, and supporting the next generation to succeed. So that was what I got out of it. That's why I wanted to do it. And I'm really, really pleased for Mary that I was able to help.
Brilliant. Thank you so much. We've got we were supposed to have Q&A after this, but we've got we've run out of time to ask for any questions. But just looking at the chat, there's a real sense of connection to your story, Mary, and there's a lot of gratitude and love that I might add for what you've been able to share with us today. And I just wanted to share something that a colleague of mine who went through a similar story to you, Mary, about going on various things, people saying, yes, you're great, but her reflection was, it seems as though as a woman of color, I'm admired for what I do, but I'm not desired. So that sense of saying, yes, you've done really, really well, but it does feel disingenuous and really is unhelpful. So thank you for exposing your mentor-mentee relationship for us to really have a look inside and to learn some things from that. But we will have time at the end for questions and answers. So I've gone a minute into the next session's timing, which is a way to hear about how to improve your chances of success. What are employers and recruitment agencies looking for? And Tom, Sam and Rhiannon are going to step us through this segment. So over to you guys.
Thank you, Heather. So Holly is with us as well, I should say. So yeah, hi everyone. So we're here to talk, really, the topic of our session is on what are employers and recruitment agencies looking for. So hopefully there's some good things that come out of this. But delighted to say that we're joined by Sam Shah today. So Sam is someone that I really admire. He's incredibly influential in the digital health space, which is where I work, and someone I have a lot of time for. And I think one of his incredible attributes is how much time he makes for other people as well. So really happy that you're here today, Sam. And I thought we'd start our session, really, if I could ask you to talk us through your journey so far in the digital health sector.
Well, Tom, thank you for inviting me. Great to be here today. And I have to say, to start with, I mean, wasn't that just the most incredible and passionate experience that Mary's had and shared with us? And it's certainly something that's going to stick with me. But I feel really encouraged by what Mary said, and I'm going to pick up on a few of those things in what we're going to talk about too. But thank you, Mary, and thanks for Shuri Network for putting this together. Well, my journey, picking up on things said earlier, I could argue that I am where I am completely by accident, maybe slightly haphazard, but it has sort of spanned a bit of everything. It's spanned going through working in retail technology, financial services, being in clinical practice and training clinically, and then working across public health, education, consulting, and digital health. And so I sort of feel like I've been really lucky in that I've had a go at doing absolutely everything, and now ended up in a place in a digital health company that really focuses on trying to improve access to difficult areas of healthcare. So I've been super lucky to have been through that journey, but I definitely wouldn't say I probably set off 20 odd years ago thinking this is where I'd end up. And part of it's been the pivot, sort of just making sure you keep on top of what's happening out there and working out where do you want to go and what looks interesting and exciting at the day.
What's a bit of advice that you'd actually say from your journey then?
You probably talk to some really interesting people that probably have really structured answers to how they get there, especially when you're doing interview prep with people. But I would say my first thing is really don't give up, and to see and look beyond the existing boundaries and structures. Because one of the things you'll find is the world we're in, the system we're in, has existed for a really long time. So everything might seem really formulaic. It's already been really structured, like especially in the NHS, where you've got really banded roles or organizations, and try and see beyond that. Make yourself the change maker if you can. And so look for a path, look for an alternative. A really good mentor, friend, ally of mine said to me, you know, if you can't open the door, go and find the window. And if the window's not open it, wrench it open, get inside and find a way to get in. And this was my postgraduate dean, who was my trainer, who was my consultant, who was my TPD, who then became my boss when I worked in HE. And, you know, the main thing is just look for that path, look for that alternative way in. And the other thing, and this is really hard for people to do, especially people that may not necessarily be as confident to start with, be a bit militant. Somebody who I used to work for, who's at GE Healthcare, said to me in consulting, he said, be militant, be exceptional, but be militant. Now, most people on this call are already exceptional. They've just got to find the confidence to demonstrate their exceptionalism, but be a bit militant as well and try and, you know, be sure about what you want and just go for it. And don't be deterred when you don't meet the criteria, when it looks like it's a little bit narrow. Actually see that as opportunity and position yourself with a set of development needs and turn that into the opportunity that you have, because it shows that bit of vulnerability, but it also, I think, shows that you're thinking about your future and your own development.
What about
that
key
confidence
skills?
point? Sorry, Holly.
Oh,
I was going to say,
okay.
Sam, I think that confidence point is really critical, isn't it? I had to give someone some feedback the other day that they hadn't got the job because they hadn't believed in themselves enough. The only person who doubted his ability to be there was him. And I think that how do you keep going? How do you keep believing in yourself? I think that's what's amazing about Mary's story, isn't it?
Do you know, and again, that was really powerful in what Mary said, but I can equally understand that. I can equally understand that people that haven't been given a chance before, maybe haven't been told they're not good enough, maybe been given those post-interview reasons that aren't real, that we all sort of see through and all of that, it probably damages people's confidence over time, especially if you've been in a role for a long time. It's a bit scary going elsewhere. So find some allies, find some friends, find some people who are going to tell you about how wonderful you are, about all the great things you've done. Just remind yourself of the positives you bring to a role and use those, start those off as your better strengths. Use those as a way of just making yourself confident when you go in. And remember, you're there because actually deep down, you think you can do it. You know you can do it. You've just got to get that across to the other people you're talking to. And you've got to do it in a way that is, yes, shows your vulnerability, but also shows that confidence that you know you can actually deliver this and achieve this. So use it as a strength, and but find some allies, find some friends, talk to them, do some prep, talk to a few senior managers and leaders you know, and let them give you that pep talk that none of us are really good at receiving, but does wonders for us before we go into an interview.
Yeah, I completely second that. I think whenever I'm doing prep work for women in particular that are senior within digital, I will consciously put more time into building them before the interview, and they can often need a second interview to relax. So reach out to someone and do a preparation interview would be a massive benefit to anyone, really.
When we're nervous, you know, we all talk faster and we pack loads in. Actually, a little bit of prep to slow us down a little bit, just take some time in a moment. Learn those little tricks of how to just take a moment to think, but by saying something to buy yourself time. Those little things help, and for the interviewer on the other side, they might come across as sort of at least showing some confidence, even if inside you're a complete wreck.
What would you actually say the kind of would be your advice on key skills needed to be kind of an effective digital leader?
Wow. Somebody tell me, please. I wish I knew. No, okay. So I'll give you some thoughts. These are obviously my personal views, and I suspect everyone here on this call has got their own take on this and things that work for them. These are the few of the things that have stuck with me, certainly over the last 10 years. And I'd say the first thing is work out your strategy. This takes time, this takes effort, this takes investment, but, you know, build on your strategy, both for yourself or for the program you're leading. If you're an effective digital leader, really focus on the strategy for the thing that you're delivering. What would good look like in that strategy? And that's really important because you'll need that when you present yourself for your next role, for that promotion. You'll need to demonstrate you had a strategy. This is your strategy. You executed it. These are your results. Then think about your teams. I cannot stress enough, whether your colleagues or your the people that you look after, or even your seniors in some cases, give them creative solitude, give them time to themselves, give yourself time to yourself, to think, to learn, to be creative. If you can, 20 to 30% of your time would be great in this space, because it really gives you that time to focus and get things done, but also giving yourself some time to just have a clear head, which often in all our roles in the health service, who has that time when you're constantly fired with, operational stuff and other things? Really give yourself time. I can't stress enough, for me, investing in your team is one of the most powerful things you'll do. Investing in your team, giving them your time, but also helping them get more skills is such an important thing. And that might be something as simple as just talking to someone about something you've learned, or it might be sending them on a course and giving them time to do that. And sometimes it might feel like it's completely different to the area you're in. As an effective leader, we have a responsibility to train the next group of people and give them an opportunity. And so I think that's important. And then the final area for me is comms. Learn to have conversations, learn to form that network, and that network will enrich your work. You'll learn from it. You'll bring some fresh ideas in, especially from outside. Some of the best sort of intelligence, the best learning I've had is from outside of the health system, because we all talk to each other every day, and we're probably all experts in our own domain. When we're learning something new, it's great to look outside and see what's happening, but suddenly that innovation spark happens and we'll do something new, think of a new way of approaching it. And I'd certainly say in my network, some of the best colleagues I've got are from military, cabinet office, Ministry of Justice, other parts of the system that often will give me ideas and ways of tackling problems that I won't have seen myself. But those safe contacts, those networks and other areas, they'll both teach you and help you how to progress, but also ways of solving your problems in a safe environment. So get uncomfortable with some conversations. Be happy being uncomfortable. Learn to have a difficult conversation. That's never easy, but you're going to be focusing on culture change if you're a digital leader. That's probably the biggest thing you're going to do. And culture change is hard. You're going to be the person telling people to do something differently. Automatically, the portcullis has come down and they're not really wanting you to make that change. So get ready to be a bit uncomfortable. It's okay. And you're not going to have great days every day, but just learn to find that safe thing, which takes me to my final area, well-being. Give yourself that opportunity for well-being. Aisha, who's here, is great at this. She encourages all of us to do this, and she's really good at encouraging them all to do this. But do give yourself some time to go and do something else. Go to the gym, go training, go running, give yourself some headspace away from work, nothing to do with work. I love going on the trampoline. My 3-year-old ensures that I do that. But you have to do something that splits up the week, that breaks down, that because you're going to take a lot of emotion on, have a release point. So they're my top tips, but others here are probably much better place to even give other views as well.
I think that networking point is really, really good though, isn't it? And it's so critical for everyone's career journey, building that network. But I think lots of people hear the word network and go, oh my goodness, how do you do that? I don't want to go to drinks parties and have lots of glasses of sherry. People get a very old fashioned view about what networking is, isn't it? I suppose my advice on that would be, everyone says yes if you ask them for a cup of tea. Can I have a cup of tea and pick your brains? Can you just spare me 5 minutes to talk me through your story? I'd love to learn from you. That's always been my experience. Was that yours, Sam, when you were building your network?
It's so true. Whether that's been, your good colleagues, Tom and Duncan, indulging me with a coffee, whether it's been other people who are here that just, spend time having a chat, you'd be surprised. Ask somebody for a cup of tea, cup of coffee or a drink. More times than not, they will find a way to say yes. And it might not be immediate. It might be a little bit later, but it will happen. And, I'm always happy to try and find time either for these days, a virtual coffee or a socially distanced one. But, it's really important. And we all have responsibilities as leaders to give our time to other people, to help bring through the next group of people. I want to be in a space where my 3-year-old in 20 years time is not going to be saying, Daddy, I can't get a job. Actually, that network in the future has given some, social capital that allows the next generation to come through. So we all have a responsibility to give time, but actually try not to be afraid to ask. The worst is somebody will say no, but you will ask 40 people. I suspect 10 of them will say yes. And if it's not now, it'll be later. So, there's some great places and forums you can go to, just going to occasionally to some events, virtual events like this, just use the chat feature, message people. Like Mary said earlier, go to LinkedIn and have a look. That's such a great forum to connect with people. I know that both Shira and Aisha are prolific on Twitter. Go for it, use it. Last night, I had my first experience of using Instagram. I've never used it before. I had to use it with a patient. Really interesting. So use those networks out there.
Brilliant. And in terms of social media, I thought one of the areas that we should talk about today are key trends in the digital health sector. You mentioned Instagram there with a patient. So it seems that wearables and telemedicine are a huge part of the future. What for you are the key trends at the moment, and indeed members of the network, where should they be focusing?
So in terms of citizen facing, I would say at the moment, we've certainly seen an increase. If we look at searches for apps and wearables, it's been in the space of healthy living, eating, exercise, well-being has been a massive increase in that area at the moment, certainly in the last 6 months, which we haven't seen before. Prior to that, there were some common themes: respiratory, mental health, COVID infection were of course ones prior to that 6 months ago. But at the moment, the big trends are in the health and well-being type of arena. On the other side though, there are some great trends around, we're back in the space of record sharing. And in some ways, what's happening in public sector right now has meant people started thinking again about their records. So that's another really interesting area. And Apple's announcement yesterday was an interesting one about how records will be available on phones. So that's another trend that I'm beginning to see. And then, the other sort of big thing that's happening out there is trying to tackle the digital divide. So not necessarily everything being about digital health, but using that as a way of reducing inequalities. So that's something that people, I think, are really switched on to now, which is working out how we can target groups in the population. But definitely the big trends in terms of citizens seems to be health, well-being, exercise, diet, managing diabetes. That sort of area at the moment seems to be quite on trend right now. Of course, that might change. And on the other side, on the technology side, if you like, there are lots of workforce related things, efficiency in workforce and getting people into, rota, that sort of thing. And then on the infrastructure side, there's lots around record sharing, which I'm beginning to see is increasing again. And I'm beginning to see that people are getting interested in how they can give people, citizens, access to their records and data.
And all the information governance headaches that go along with that, I'm sure will keep Mary busy.
I'm going to ping Mary a note. I just want to record Mary talk about it, because I'm convinced that if Mary was to talk to people I have to speak to, just her passion and enthusiasm will break down those information governance boundaries. It's a cultural issue.
Yeah. Clearly, what sometimes the hardest step to take is the first one from a clinical background into a digital health background. But I think from our perspective, we see the big opportunities, especially in the NHS at the moment, is there's so much attention and indeed work going into the evolvement of electronic patient records and indeed the optimization of any clinical system in a hospital. So we were thinking of ideas around becoming a super user on those clinical systems or getting involved in those EPR deployments. Is there anything else that you'd suggest would be great for a clinician who was looking to make that step into digital? What would be a good first step?
Absolutely. And we've got to remember that clinicians are quite broad. We've got physicians and surgeons, we've got pharmacists, nurses, even dentists. We've got lots of different people across the spectrum of clinicians, allied healthcare professionals. And so we've got to remember that different people have different backgrounds, experiences, and they might want to do lots of digital or not very much. And that's okay, actually. You know what? It doesn't really matter how much they want to do. The main thing is getting comfortable. So if you're interested a little bit in your organization, find someone that you can pair up with just to get involved, whether it's giving your ideas as a user or it's getting more involved in that. Find out who the CIO is, the CCIO is, the CDIO is, the CTO is, and it might be they've got a small project where you can provide some input or some help. If you really want to go to the next step, then there's lots of things you can do. You could do an academic program in clinical informatics, digital health leadership, digital health, and that might help you take your career to the next place. But that's not essential for everyone, and it's not always needed for everyone. But the main thing is get a balance of experience, some academic work where it makes sense, but you might already have lots. But the main thing is get to know the environment you want to work in. It's okay if the first area of clinical informatics, digital health isn't the thing you want to do. It might change. And for lots of people, it changes, and Aisha was mentioning this earlier. I know Heather and I have talked about this as well from some of the other things we've been doing. it's all right to sort of move around the system. That's the benefit of digital health and clinical informatics. But as a clinician, don't be scared. There's always something, whether you're the person agitating and giving your views, whether you're the person involved in designing the technology, there'll be something there for all of us. And sometimes it's just a case of getting a bit of experience. And if you can, go outside and get a bit of experience. Try and get maybe a couple of days as an attachment to a software company, to a tech provider. There's some really good ones out there that will give you some time. That will also help you gain more experience outside the system where you can get involved. And the Faculty of Clinical Informatics is a great way to become aligned to a professional body that has got a future in digital health and clinical informatics. You don't have to do that, but if you're taking a role of sort of going toward the CCIO route, it could be a helpful thing to do, be part of that community. But join the community, join the network, be part of the conversation, and don't be afraid. There's no bad question and no bad idea.
Yeah, I think it should be kind of recognised as well in yourselves, and the fact that actually there are a lot of, I don't know, project or program management individuals that have come through from a clinical background, and I don't think they realise until they've gone into it how valuable it is to have a clinical background when you step into the digital space. Just by initially becoming a kind of clinical sponsor for a system implementation in some way.
Totally, Holly.
There's a lady that I know that she actually, her first digital role was she stepped into the program director of an EPR, which 100% is gutsy, to say the least. But from her perspective, she'd started as a nurse, got into kind of clinical ops management, and then she made the decision to transition into the senior digital program director role because she really understood what the difficulties were from a ground perspective within the organisation. She knew, she had the passion for technology and how it can improve the patient journey and generate better data for the organisation. Like, she understood what those benefits were, but her point was she knew firsthand what the difficult points were, what the people working for her were finding on a day-to-day basis, and how that can be benefited from her. What was that, sorry?
And Holly, I think that's so important because those individuals provide the benefits of making the change, right? They know where the pain points are. And I don't think there's either or. I don't think it has to be clinical or non-clinical, but I think where clinicians are looking for that jump, they can do things that will help them bring that out. So if they do learn a little bit about agile project management or agile delivery, that will help them reflect and demonstrate how those benefits of change can be part of a program, and they can advocate for it. And you're quite right. They know where the pain points are. They know where the solutions are. So as part of a multidisciplinary team of clinicians, non-clinicians, I really do think clinicians add value. And I would say, if we look at what's happening right now across the NHS, you can really see the balance and the benefit of having that blended team, especially in digital health. And I would say to anyone thinking about a career in digital health, have a look at other people who are in roles that you're aspiring to, whether you're a clinician or non-clinician, and work out what those individuals have done, because that might give you an idea about the sorts of things you might want to do to sort of develop yourself. And, as teams, we can all learn from each other, but there will be things that you'll see in other people's roles and in their work experience and in their backgrounds that might help you pick out what the sorts of courses, skills you want to develop to go forwards.
Brilliant, guys. Thank you so much. I was just looking at the chat and some fantastic questions. I've got a couple of questions here, and thank you to Aisha and Mary and Sedi and others who've been posting in the chat. But Shamali, do you want to come on and ask your question about it's for Hunter Healthcare, actually, about being an interim, sorry, it suddenly got noisy in the office that I'm in. You can probably hear. As an interim ethnic digital woman working in the NHS, not only do we deliver on our statement of work, but often mentoring and role modeling on the side, which goes unrecognized. How do organizations like Hunter Healthcare leverage and maximize this unique position?
I think, hi Shamali, by the way, we do know Shamali. But I think to be honest, we're trying to do more and more is probably the honest answer. There's probably much more that we can do. I think from our perspective, we are there to try and create introductions to find and help find mentors, I suppose, and equally do as much training as we possibly can in preparation for interviews. And if people want to become mentors, is be the introduction or the other side of things as well. But we're also, you know, happy to learn anything further that we could be doing from our side of things as well.
I think on the networking point, the other tip I'd give you is, you know, on top of the just ask people, because it's amazing how often people will say yes, but also when you've had that conversation, ask them, is there anyone else you think it would be useful to introduce me to? Is there anyone you'd recommend I had a conversation with? Because it just grows and grows exponentially, and you suddenly find out that you haven't got a network of 10, you've got a network of 100, and then all of them can make a recommendation as well.
Brilliant, thank you guys. I've got another question that I've picked up from Lara. How do you go about shadowing senior managers or directors in senior role or people in senior roles? And Faith wanted us to add to that, particularly in post-COVID. What are some ways that we can get hold of people to shadow and mentor? And maybe Aisha, do you want to?
Yeah. Well picked up on, Heather. Yeah. So I don't think I've ever refused to have somebody shadow me. So there may be some sensitive board level conversations where it might not be appropriate to have somebody outside of that group to be party to some of those conversations, but in large part there's absolutely no reason why somebody can't, say, join in a meeting virtually. So yes, of course, most of us are in Teams meetings or Skype meetings or Zoom meetings back to back most days. But actually that's a really easy forum to sort of come in, because you don't have to put your camera on necessarily. You can be in the background, and as long as the person chairing that meeting is aware and is given permission, that's absolutely fine, and you can get so much out of that. So I have done that with a few people, and what we've done is I said, look, here are some appropriate meetings that might be helpful for you to just learn a little bit about what the job entails, and then we've organised a debrief session afterwards to sort of say, well, what are the things that you found interesting, what things were not so clear, you know, what is the learning that you're taking from this, or what things do I think you should pick up from those. So most senior leaders are really, you know, happy that somebody's interested and enthusiastic in their area of work. So I would say send that email, you know, ask the question if you haven't necessarily spent a lot of time with them. Most people will be really receptive to the approach, and if there isn't something that they can do that's helpful, they will generally point you in the direction of somebody else that can help.
So Shura, would you like to come in and answer that?
Yeah, so we've all had to adjust how we do things post-COVID, you know, so that's why we're not in a room meeting each other face to face today. But the Shuri Network, we're currently developing our shadowing program, which will be fully online. But one of the advantages is it removes the geographical barriers. So you can actually shadow someone if you're sitting in London, like myself, but I could shadow someone in Dorset or in Edinburgh, whereas before that would have been really hard. So we are hoping to launch that in the next couple of months, certainly before Christmas. So do join the Shuri Network through our website to get the latest news, because I don't think anyone else is doing online shadowing right now. I think we're leading from the front. So it's very exciting, and we hope it will help you in your career.
Very, very good point. And the world is actually more touchable now that we're digital. So please make the most of that. Audrey, you switched your camera on, my dear, and you had a question. Is that about shadowing, offering shadowing, or wanting to shadow?
No, I wanted to say thank you for the opportunity. It's my first session, so it's good to hear I'm at the right point where I can have virtual shadowing, because I've been trying to get hold of I've got a lot of senior directors in front of me, but even today a shadowing opportunity was cancelled due to the acuity. So it's good to have this opportunity to do it virtually, because I'm here, this person is not available today, you know what I mean? So it's happened, at least it's the second time now it's been cancelled for one reason or the other, or opportunity to have a mentor, they don't get back to you within the organization. So this is the right, I'm grateful for this opportunity.
Brilliant. And I want to borrow some of Sam's words. Be militant and don't be deterred. Accept their apology and then book into their diary again. Make sure that you get that opportunity.
Yes, I'll do that straight away. They must think, you know, this one doesn't let go. It's like I'm a dog with a bone. I always go back and say, thank you for response, but I'm happy to see you when you're free.
Brilliant, brilliant. Bankole, you were asking whether a CCI role is something you can pursue if you have a commissioning background. And
yeah, that's correct. So I was just thinking, because I'm mainly a commissioner and all of the CCIOs are clinicians. So I was just wondering whether it would be suitable for somebody who's a commissioner to actually have the opportunity to shadow somebody and get into that role, or get into a higher role.
So that might be for Shira and Aisha. Do you want to, or Sam, did you want to respond to that?
Happy to start off. So look, I think the first thing is you would add immense value from a commissioning background. If you're a clinician, you might take the CCIO route. And if you're not a clinician, you might sort of take a slightly different route, or one of the CDO type routes. But the main thing is, as a commissioner, you've got immense system experience. So you should definitely shadow any of those type of people. And if it's something you want to do, you should go for it and try and get into a digital health role. And I'm sure there's good colleagues here who'll give you some time about how you might do that. But definitely don't give up. And commissioners, and I was a clinical commissioner before, I went in public health. So I would definitely urge you to use your commissioning experience because you can add value about needs, about where the system should change. So do it.
Thank you very much for that.
If I can offer a perspective as well, yeah, so a CCIO is specifically a clinical role. However, one of the really exciting things is that now is a great time to get involved in digital health because of COVID partly, that it's really raised the topic of digital health transformation on everybody's agenda, whereas it was a little bit more niche, I would say, before COVID. So what that means is that there is the opportunity to create roles where they didn't exist by having those conversations with people that are in a position to advise on those kinds of things. And exactly as Sam says, we're all supposed to be working in systems rather than isolated silos and individual organisations. So there is plenty of opportunity to start having those conversations within your ICS or STP area with AHSNs and seeing, what their perspectives are and just sort of linking those things together and thinking, actually, you offer a perspective that is unique as a commissioner that has an organisational part of the system that is very influential, incredibly influential. So to have somebody that's digitally literate and interested and can contribute to that conversation from a completely different perspective, I think brings enormous value. So I would say start having those conversations, ask what people might envisage as a role being for somebody in the commissioning space, and you might be surprised that people are really receptive to that, where perhaps a formal role doesn't exist. Why not see if you can contribute to creating one?
Brilliant. And I just wanted to say here, again, quoting Sam, get uncomfortable, learn to love difficult conversations. And if ever a member of our system, the workforce, who would be good at having difficult conversation is a commissioner. I think you have some really good skills at holding the line, holding people to account, having the health of the population in mind, and knowing exactly what needs to be done and working through others. So you're already there. And I'm sure if you shadow Aisha, Shira, Sam, one of the CCIOs on this call, you're on your way. There was a question about Shuri Network. Laura wanted to know whether we provide support with interview skills or prep work for interviews in digital health or any roles. There's a whole load of stuff. Shira, you're itching to come in here, I think.
Yes, I'll jump in, and maybe Rhiannon, Tom or Holly could jump in too, because Laura, that's exactly what they've suggested we do in a future workshop, because Hunter Healthcare, award-winning recruitment agency, they know what it takes at interview level, and I've just done a Zoom interview, a Teams interview, and it's very, very different to being in an interview face-to-face with a panel. It's much harder when you can only see people's heads. So I think there's a different skill set that we need to think about. So great question. But Rhiannon, I don't know if you and Tom or Holly want to come in on that.
No, I think it's a really relevant question. I think it's what keeps people awake at night, isn't it? Everyone hates interviews. I think it's a chance to talk about yourself for an hour. What a delightful thing to do. But that is not everyone's experience. I recognise that. So yes, we've put together some slides for another session when we can talk you through how to make the most of it and how to try and feel comfortable doing it. Because in an interview, people take you at your own evaluation of yourself. That's why the confidence is so important. So being in a place where you believe is what really counts. So yes, we'd love to help you with that.
Yeah, I think there's lots of opportunities there. One bit of advice that was given to me recently was was treat the interview as the first day in the job that you're interviewing for. And it just really sort of gives that poignance around feeling like you're already there and you're certainly qualified to do it.
Brilliant. Thank you, guys. So this has tested my chairing skills because we've only got 1 minute before this session is due to end. And what I will say before we go is I did hear Sam make an invitation to Mary to come and talk to his colleagues about information governance. I thought I heard that. So already the networking has started for us. This has been amazing, guys. Thank you so much to Hunter Healthcare for joining us to have a conversation with over 65 people who joined us today to listen and have a conversation about being successful in our careers as women from Black, Asian and ethnic minority backgrounds in digital health. And without further ado, I will send you back into your workplace or your homes or to lunch and to say thank you to everyone.
Thank you, Heather. Bye now.
Thanks, Heather.
Thanks very much.
Thank you for having us.